My name is Andrew Wang. I'm a professor of medicine at Duke University School of Medicine in Durham, North Carolina. We wanted to look at multiple domains that we consider markers of disease burden in obstructive hypertrophic cardiomyopathy, not just a single or secondary endpoint. We wanted to look at the response to these two monotherapies across a sort of a domain of multiple different parameters. So we defined clinical response across 5 different parameters that we considered markers of disease burden, including the reduction in left ventricular outflow tract, the biomarker response, improvement of cardiac symptoms, heart failure symptoms, the reduction in left atrial volume index, as well as exercise capacity. So we felt all of this was a comprehensive assessment of really what patient with hypertrophic obstructive cardiomyopathy faces. We studied patients that were in the MAPLE-HCM randomized phase 3 clinical trial that compared Aficamten monotherapy to Metoprolol monotherapy for 24 weeks of treatment, and we looked at the responses at 24 weeks. For symptom improvement, Aficamten was superior to Metoprolol therapy, and that was one of the parameters in the multi-domain assessment. Aficamten was superior really across all of the 5 different parameters of clinical response to varying degrees. When we compared the number of responses each patient had, patients who had more positive responses, meaning out of the 5 criteria, which ones did they meet, did have, interestingly, a higher prevalence of hypertension. But when we adjusted for the presence of hypertension, the results were the same. When we see a positive clinical trial, it's usually for the primary endpoint, that a single endpoint is statistically significant better for one treatment or the other. This pre-specified analysis allowed us to look across a wider range of endpoints to see the sort of the global response. And so if we're thinking about the patient to say what matters to the patient over time, this analysis may help to inform, it's not just one endpoint we're achieving, it's multiple. So this was a study of patients who had symptomatic obstructive hypertrophic cardiomyopathy. There's an ongoing study now of Aficamten for non-obstructive hypertrophic cardiomyopathy that should be read out next year, hopefully. And that will be very important information because currently we do not have specific HCM-related medicines for non-obstructive HCM.